United Kingdom has become the first country in the world to approve the coronavirus vaccine developed by Pfizer and BioNTech. The rollout will start next week with the over 80s, NHS workers and staff in care homes at the front of the queue. After that, it will be allocated according to age and assessment of vulnerability. The Prime Minister warned that the three-tier system in England and the separate regimes in Scotland, Wales and Northern Ireland remained crucial and that people needed to continue to follow the rules. The MHRA, that's the regulator which approved the vaccine in record time, insisted that no corners had been cut in the process of approval. Our medical editor Fergus Walsh has the latest.
This is an historic moment. At last, there is a clear path out of this pandemic, thanks to vaccination. The UK is the first country in the world to approve the Pfizer-BioNTech vaccine, seen here on the production line in Belgium. The Prime Minister made clear the vaccine won't change life for now, but hope is on the horizon. Prime Minister, now we have a vaccine. How important is this moment?
When you consider the damage that, as I was saying earlier, the damage that this virus has done to human life across the planet, the economic damage, the social damage, to say nothing of the cost in life and suffering, it is a fantastic moment.
More than 20,000 volunteers got 2 doses of the vaccine as part of the trials. It proved 95% effective at preventing COVID, even among those in their 70s and 80s. Side effects were mostly mild. A small minority suffered headaches and fatigue. The independent medicines regulator, the MHRA, began work on COVID vaccines in June, and for the past 2 months has been reviewing more than 1,000 pages of data on Pfizer's trials.
No corners have been cut. Our expert scientists and clinicians have worked round the clock, carefully, methodically, poring over tables and analyses and graphs on every single piece of data.
Creating a completely new vaccine usually takes at least 10 years, from design and development through trials to regulatory review and production. This has been compressed to less than a year. Many stages were done in parallel, and Pfizer began vaccine production at their own risk, even before they knew it worked. 800,000 doses of the vaccine should arrive in the UK within days. 40 million have been ordered in total, enough to immunise 20 million adults. But the vials have to be transported from Belgium in special containers at an ultra-low temperature.
It's like a pizza box. They then get put into a thermal shipper packed with dry ice that then maintains the temperature at -70 if unopened for 10 days.
The committee which advises the government on immunisation says the elderly and frontline health and care workers should be first in line.
We are suggesting that vaccines are offered in order to protect people who are most at risk of dying from COVID-19, as well as to protect health and social care services, because by doing so, we also protect lives. Age is by far the single most important factor in terms of risk from COVID-19.
Getting rid of social distancing and other restrictions next year will depend on tens of millions of us being vaccinated.
We need people to take it. This vaccine isn't going to help you if you don't take it. And you will need 2 doses of this vaccine and most of the others to have full protection.
More COVID vaccines could be approved within weeks. The goal then to immunise not just the UK, but the world. Fergus Walsh, BBC News.
Both Downing Street and the UK medicines regulator appeared to contradict a claim by Matt Hancock, the Health Secretary, that swift approval of the vaccine had been possible because of Brexit. The MHRA said that the supply had been authorised using provisions under existing European law, which are still in place until New Year's Day. Rolling out the vaccine will be a huge logistical exercise, as Fergus was saying there, which could also be affected by a post-Brexit deal, as the supplies will come, as we know, from Belgium. Our health editor Hugh Pym has more details.
The NHS is ready, though it's a huge task starting next week, vaccinating first its staff and other priority groups. And those likely to receive the jabs, including nurses who went through the first wave, know how important that is.
As working as an ICU nurse, especially in the first surge, a lot of the nurses were living away from home and they were concerned about bringing it home to their families.
If we do have the vaccine, it means we can get back to living a more normal life. Life has not been normal for the past several months.
The official first phase priority list is headed by care home residents and carers, followed by the over 80s and frontline health workers, then lower age groups and younger adults with health conditions. But it'll be NHS and care staff and the over 80s who actually get it first. Health leaders say hospitals will be the focal point next week.
The idea for the first phase is that we concentrate on NHS hospitals delivering this vaccine because of the particular requirements of the Pfizer vaccine.
But care homes are now wondering what all this means for their residents and why they don't now appear to be top of the list.
It's really disappointing, and obviously there's potential implications for our residents as well. Should we get another outbreak of COVID, then they're more likely to suffer some serious consequences of that.
One reason is the way the doses are packed. It's emerged that approval by regulators is still required to allow them to be broken down into smaller consignments to be taken into care homes.
As soon as we have the regulatory sign-off that we can do that, we can get the jabs to the care homes so that the GPs and the nurses can then arrive and give those care home residents that COVID vaccination, we will do that.
In Northern Ireland, officials have set aside a new hospital emergency department as one of 7 designated vaccination sites. The Scottish Government also plans to prioritise health and care staff.
The first vaccines against COVID will be administered in Scotland on Tuesday the 8th of December. So you can perhaps understand why I've probably smiled more in the last few minutes than you've seen me do in several months.
There's now an accelerating drive to set up vaccination hubs for the wider population, including one at Epsom Racecourse. Even a village hall in Surrey is being prepared as a site for vaccinations in the local community. The new vaccine is on the way from Pfizer's Belgian plant. It's a shot in the arm for ministers. They'll hope that Brexit doesn't affect the continued smooth running of this vital supply chain in the new year. Hugh Pym, BBC News.
With me is our medical editor, Fergus Walsh. There's been lots of talk today, Fergus, about a major milestone. How would you describe what's happened?
Well, Hugh, today, for the first time, we can say with certainty that we have a safe and effective COVID vaccine. And that's an extraordinary achievement to manage that in less than a year. Now, yes, the UK was the first country to approve it, but it's gone through the hands of a very well-respected independent regulator, so the public can have confidence in this vaccine. All medicines have side effects, but there were no serious adverse events on the trial, and the volunteers will be monitored for the next 2 years. And you have to set aside any side effects against the real known profound dangers of COVID, especially to the elderly, but also the lingering health problems you get with long COVID. Now, we don't know whether the vaccine stops people from passing on the virus. We should find that out in the next 6 months. And we don't know how long any protection will last. We may need booster doses in years to come. So the sooner we can start the mammoth task of immunisation, the better.
Fergus, once again, many thanks. Fergus Walsh there, our medical editor.